When the child is born with a birth defect. Some birth defects are visible as soon as the child is born, like a clubfoot or an extra digit or a finger sticking to each other, condition called syndactyly. But there are some conditions which is not visible at the time of birth. One such condition is a congenital hip dislocation or developmental dysplasia of hip. How do we diagnose this at the time of birth? As soon as the child is born, pediatrician or a pediatric orthopedic surgeon examines the child and find out whether the hip is stable or not. If the hip is unstable, this can be treated with splints, which will completely cure the problem. But unfortunately, we still end up seeing a child presenting at the age of 1 year, 2 years or 4 years with a hip dislocation. How do we diagnose a child with a hip dislocation at a later age? Because the hip is dislocated, the leg will be short, child will be walking with a limp. If both the hips are dislocated, they'll walk like a duck, waddling gait. So once the diagnosis is made, if the child is old or 1 year or more, we always talk about open reduction and reduction of the hip joint. Always better to diagnose this early so that we can avoid surgery and we can treat it without surgery to get a good recovery. But even at the age of 4 years, we can make the child do well with surgery, but we have to talk about major surgical reconstruction.